interesting case because on first glance you look at it and you're like, what's the problem? Like, that's actually the exact same thing I said when I first saw her for a consult. But as we went a little deeper into the case and discussions with the patients, I'm realizing that this now is a revision case of something that was done less than a year ago. There's discomfort associated with it, and then there's some other aesthetic issues as well. And I'm gonna start just kind of pinpointing and outlining them right now. So as you look at the smile, there's actually a cant. So as we look at the smile, the teeth are going this way, right? And so the gum line is going this way, and then the teeth length are going this way. So this tooth is actually longer than this tooth. And then this position is much lower than that. And so when the patient said to the doctor, hey, this tooth right here is longer than the other one, what's going on? The doc was like, you know what? That's kind of how the smile is. That's how your lips are, you know, all of that. And she kept saying, can you make it shorter? Can you make it shorter? And unfortunately, they couldn't. The other thing that she kept mentioning to the doctor is my tooth is getting yellow. And she's like, the doctor's like, oh, you're drinking a lot of coffee, and so it's starting to stain, which with veneers, that actually does not happen. So what I'll show you is actually some x-rays of what's going on underneath that veneer, even though from the front it appears like everything's okay. From the side, they decided to leave a gap. So when I retreatment planned this patient, I said, unfortunately, we can't only do 4. You have to do a minimum of 6 because that front aspect of the canine needs to overlap and the backside of the lateral. So essentially this area needs to be fully filled in. And if we go back, these canines need to look like canines as opposed to flat, worn down teeth, so that the entire smile then is going to really be kind of in this position, all right, following the contour of her lips and of her smile. And up top, it's going to all be like this. So that we're gonna take the smile from like this to that and keep it nice and symmetrical and balanced. So if we look at that x-ray, what we're seeing is a root canal with a tooth that basically nothing holding it on. So I had to redo this post and then build a larger sort of tooth structure so that there was something for that crown to be on. And then the other part of why there's yellow going on underneath the tooth is actually because there's micro leakage. You can see that that's a void, and then that's a void as well. And so that aspect needs to be fully sealed so that nothing can leak into the tooth and essentially bacteria traveling into the porcelain veneers. So those are really main reasons why we have to go ahead and do the revision from aesthetics and even more so from a health standpoint. So we took all those factors into consideration. We made the canines on the porcelain a bit more looking like canines, the heights of the veneers with the natural teeth. We're now straightening that out, as you can see on the model. Whether it's a crown or a porcelain veneer, essentially these two teeth, because of the incredibly talented ceramics that we use, look identical. And if we look from the backside of this case, you can see this is my veneer preparation. That's these two teeth. And then these are the other veneer preparations. Much different veneer preparations. Mine is very conservative. This one is quite aggressive. This is just how different dentists have different styles. Veneers is the exact same thing. So obviously this is now a crown. So if there was a crown, we have to make it a crown. And so I want to look at the new x-ray. Here you can see I rebuilt this area so that there is more tooth structure to hold on to. And then more importantly, if you follow this line all the way across, you can see that there's a perfect seal along the margins of that veneer. So there will be no discoloration moving forward. This is the photo from the profile. Remember why we had to do 6 rather than 4. We closed that gap, we closed that area, and we then matched. These are the natural teeth, and then this is our work over here. This is matching porcelain veneer work to natural teeth. And again, from the front, we can see how these two teeth are now the same length, the same shape, the same color, and more importantly, following the contour of the patient's smile for a healthy and beautiful final result.